Hi guys, my name is Sarah Belcher and I am a dental hygiene student at IU Fort Wayne, and I will be conducting a training program called Let the Tooth Be Told, Effective Dental Biofilm Removal. The training overview for this training is going to allow the trainee to learn how to effectively remove dental biofilm or dental plaque using proper brushing and interdental cleaning methods and techniques. It is really important to understand these proper brushing and interdental cleaning and methods and techniques to ensure that the trainee is removing the most amount of dental biofilm to prevent cavities and gum disease. The trainee will also learn about different dental products, how to use them, and how they will help them to succeed at effective dental biofilm removal. This training is beneficial and crucial to maintaining optimal oral health. Every training has a training objective, and this training objective is as follows. Upon completing this online video and hands-on training, the trainee will be able to demonstrate effective dental biofilm removal through proper brushing and interdental cleaning methods and techniques with 95% accuracy based on the information presented. This process should take up to 5 minutes and should be completed at least 2 times a day, morning and night. The intended audience for this training is going to be anyone with teeth, from babies all the way to geriatric. There are going to be a couple of required materials or dental supplies for this training, one of which is going to be a soft bristled toothbrush, some fluoride toothpaste, some dental floss, some mouthwash, and last but not least, some dental film disclosing tablets. I am going to be demonstrating a few extra dental supplies today. However, they're just for demonstration purposes only, and they can be used in conjunction with the required materials listed. Again, this training should take about 5 minutes to complete, 2 minutes for brushing, 2 minutes for interdental cleaning, and 1 minute for mouthwash. This training should be performed at least 2 times a day, preferably in the morning and once at night before you go to bed. This training should occur anywhere that there is adequate water supply and a sink. Also a mirror available, so preferably in a bathroom. There should also be a considerable amount of light so that the trainee can adequately see their performance in a mirror. And this training can be performed standing up or sitting down successfully. I'm going to go ahead and talk about the steps to this training. Step number 1 is going to be gathering all of your dental supplies. So again, it's preferable that this training takes place in a bathroom. So if the trainee has a designated area for all of their dental supplies, that would be ideal. That way they have everything ready to go, handy, and they're all ready to go and motivated to use. Step 2 is going to be brushing your teeth. So I'm going to go over a couple of different methods and techniques today, but I just want to briefly go over the basics. So you want to make sure that you have a soft bristled toothbrush. Make sure that there's an S on the package that stands for soft. You don't want anything above a soft because that can actually damage your gum tissue. You also want to make sure you're using fluoride toothpaste because that can remineralize your teeth. It can help strengthen your teeth, and that's going to help prevent cavities in the future. So anyone under the age of 3 only needs a rice size amount of toothpaste on their toothbrush. Anyone over the age of 3 needs about a pea size amount of toothpaste on their toothbrush. So you really don't need a lot of toothpaste to adequately brush. So I'm just going to quickly go over a couple of brushing techniques. I'm going to show you on my model here. So the first one we're going to talk about is called the modified Bass technique. Now this is for somebody that has a really healthy mouth and they don't have any recession at all. Recession just means that your gum tissue has started to recede away from your tooth and you're seeing more of the root surface of the tooth. So this is for anyone who does not have that one. So you're going to want to start with a 45-degree angle. So you're not straight on, you're at a 45-degree angle, and you kind of want to gently press those bristles of the toothbrush into the sulcus. And the sulcus is just that area of in between the gum tissue and the tooth. So you just want to kind of gently press the bristles in there so that you're cleaning those areas out, because that's where a lot of bacteria likes to hide, is in the sulcuses. And if we're just brushing normal, we're not getting those areas clean. So making sure that you're gently pushing those bristles in there, and you're going to do at a 45-degree angle some short circular motions of the toothbrush, and then you're going to end with a sweeping or rolling method to make sure that you're sweeping away all that bacteria and plaque. And then you're going to want to do an overlapping so that you are not missing any teeth or any areas. And you're going to do that on all surfaces of your teeth. The next technique is called the modified Stillman technique. Now this is very, very similar to the modified Bass technique that we just talked about. However, this is for people who do have recession or periodontal or gum disease. So their gum tissue is already started to recede, so you don't want to place the bristles of the brush in that sulcus anymore. So you just want to gently place it at a 45-degree angle on the gum tissue and on the tooth. And so instead of putting it in the sulcus, you're not putting it in the sulcus this time. But again, you're just doing circular motions and you're doing that sweeping motion. The next one I want to talk about is the Charters technique. Now this is for anyone that has braces or orthodontics. You're going to come at a 45-degree angle towards the biting surface. So instead of coming like this, like the other two, you're coming down like this. That is to ensure that those bristles are getting underneath the wires and around the brackets, and you're also brushing your gum tissue. It's really important that you're brushing your gum tissue, especially when you have orthodontics on. The next one I want to talk about is called the Phones method, and this is for really young children. So you're going to have them kind of close down, and you're going to put the toothbrush in there, and you're just going to have them do really big circles. Just big circles all the way around, circles, 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 and then same thing on all surfaces. So big circles on the inside too. That is just getting them used to the motions of brushing until they're old enough to learn different techniques. The one method that I want everyone to avoid doing, and what a lot of people end up doing, is called the horizontal or the scrub method, and that's where you're just going back and forth horizontally here. You're at a 90-degree angle, and you're just scrubbing back and forth, and that can be really damaging and cause issues to your gum tissue and your teeth. So we really want to avoid doing that horizontal scrub. We want to make sure that we are getting all surfaces of our teeth when we brush. So we want to make sure we're brushing the inside surfaces, the outside surfaces, and also the chewing surfaces, because that's where a lot of those grooves are, where a lot of bacteria can hide. So we want to make sure that we're brushing all of those areas. The front teeth can be a little bit trickier because we're not able to do it horizontally, so we have to come kind of vertically. And that's where I want to talk about, this is called an end tuft brush. And this brush is really cool for the back sides of the front lower teeth. This is where a lot of times there's crowding or misaligned teeth, and this brush is really good to get into those little nooks and crannies where the regular toothbrush can't fit. Again, that's called an end tuft brush, and that's for any crooked or misaligned teeth. So step number 3 is going to be brushing your tongue. A lot of people don't realize that you need to brush your tongue, but when we eat and drink things, it kind of puts a coating on our tongue, and bacteria in our mouth like to stick to that coating. And the more bacteria on our tongue, can create a less healthy environment. So we want to make sure that we are getting all of that bacteria off of our tongue and cleaning our tongue as well. So you just want to use your toothbrush. You don't have to add more toothpaste. So after you're done brushing your teeth, just use your toothbrush bristles, and you want to make sure you're getting all the way from the base of the tongue to the tip of the tongue, and just back and forth motions, just making sure that you're covering the whole surface of the tongue. And that'll make sure that it's getting in all those nooks and crannies where the bacteria likes to hide. After you have brushed your teeth and brushed your tongue, step 4 is interdental cleaning, and what that means is just cleaning in between your teeth. There are a ton of different ways that we can do this, but for this training, we are going to use regular dental floss, and I am just going to use this green yarn so that you are able to see it better. What you're going to want to do is wrap it around. You're going to want to start with about 18 inches of floss, and you're going to want to wrap it around. Start with one middle finger on one hand, wrap the rest of the remaining floss around the other middle finger on the opposite hand. You're going to want to grasp it with your thumb and your index finger tightly, and you want to gently guide that floss. Let's see if I can do it here. In between these teeth. And you want to be sure that you're not snapping that in place, because that can actually hurt that gum tissue that's in between those teeth. So make sure that you kind of do it like a seesaw motion so it doesn't snap. So once you have it in, you want to make a C shape. So that C shape, so you want to really tightly hug it around that tooth so it creates a C. So it's cleaning the back side, in between, and the front side at the same time. And you're going to want to go into that sulcus again, because that's where a lot of that bacteria is hiding. So clean that sulcus, and then you're going to go up and down a few times, making that C motion. While you're in there, you're going to do the opposite tooth, again, making that C motion and going up and down. When you come out, you're going to release from this finger, wrap the dirty floss around this finger, and you're just going to go around and repeat that motion all the way around each tooth. And then eventually, this finger will have all of that dirty floss. And you want to make sure that you're also getting the back side of these back teeth too, because those tend to get missed. So make sure you're flossing that. You want to make sure that after you're done flossing, you throw away this floss. It's not good anymore. And then a couple of other things I want to talk to you about is this is called a floss pick. It's kind of the same thing. You just gently put it in between the teeth, and you just go up and down. The only bad downside with these floss picks is it can't make that C motion, so it's not getting into that sulcus as good, but it's better than not doing anything. And these also have a little pick at the end where you can use that in between your teeth to clean too. I also have this is a interdental brush. It's a little brush, and these are great for on the go. You just go back and forth in between each tooth, and that'll help clean those areas out too. Another thing, this is called a water pick. These are great. It's like a little water pressure for your mouth, and this is a cordless one. It can go in the shower with you, but the really cool thing about this is it's super easy to use. You just place it in between the teeth, and it'll literally blow air and pressure in between those teeth and clean all that out. And then you want to go around each gum of each tooth and put it in the sulcus, because that can actually clean out all the sulcus. And you'll just go around each tooth on the outside and on the inside. And these are really great for people who really struggle with using floss. They're a lot easier to handle. They do sometimes make a bit of a mess. This one is actually cordless, so it can go in the shower with you. So that's an awesome option. And then step 5, after you have brushed and flossed, you are going to use mouthwash. So this mouthwash is really great because it actually has fluoride in it as well. But the only downside is you have to be 12 years old or older, because you don't want to swallow or drink this, because fluoride can actually make you sick if you have too much of it. So you only want about 2 teaspoons or 10 millimeters of mouthwash. So you're going to put that in your mouth. You're going to vigorously swish that around back and forth for about 1 minute. And then you're going to spit it all out into the sink. So be careful, again, not to swallow any of it. And you're going to do this every day, twice a day, right after you brush and floss. Just go ahead and do the mouth rinse. And this is going to help remove any bacteria that's in your mouth that's left, and any bad breath odor. And it's going to also strengthen your enamel to prevent those cavities, like I mentioned before. The last step number 6, is going to be these dental biofilm disclosing tablets. You're going to just take one tablet out. You're going to put it in your mouth. You're going to chew it up, and you're going to swish it around, kind of like you just did with the mouthwash. But you got to be careful not to swallow this stuff either. It also has a bright colored dye. So you want to make sure that you're spitting it all out into a sink or a cup, and making sure that you're not getting it on your clothes or anything else. So the reason why it has dye is because it's going to show any areas in your mouth that still have that plaque or bacteria hiding. So if you didn't do a very good job, it's going to show all those areas. You're going to have bright pink or red or whatever color it is in those areas. The good thing is it's easily removed by brushing and flossing properly. So as far as evaluating, I think that the dental biofilm disclosing tablets, they're a great way to check if the trainee was able to properly and adequately remove that 95% of the dental biofilm in their mouth. There should not be a lot of bright colored areas missed with the dental biofilm if the trainee was able to use the proper brushing and interdental cleaning technique methods. So I hope that you all learned a lot today. Thank you so much. Bye.